In this video we're going to talk about the major vessels of the lower limb. Here we have an image of the pelvis, and we can see from this the major arterial supply of the lower limb. We can see the abdominal aorta lying anterior to lumbar vertebra. We can see it bifurcate into a left and right common iliac artery. We can see the common iliac artery bifurcate into an external and an internal iliac artery. The external iliac artery then supplies most of the lower limb by changing name into the femoral artery as it travels under the inguinal ligament. Principle V9 tells us that in a limb, major arteries are situated on the flexor surface of joints. Now this tells us where we can anticipate that femoral artery will travel. So I'd like you to have a go at answering these two sets of questions. Firstly, on which side, anterior or posterior, of the hip, knee and ankle joints would you expect to find a major artery? And secondly, what is the name of the anatomical space that an artery would likely travel through as it passes each of these joints? You can post your answers on the discussion forum for feedback. We also need to know how to describe the origin of arteries. So if we think firstly about the external iliac artery, which we can see here. Here is its origin, this is where it first begins, and here is its termination, where it ends. So to describe its origin, we can say that it is a branch of the common iliac artery at the level of the L5 and S1 intervertebral disc. I'd now like you to have a go at describing the origin of the femoral artery. So here is its origin there, which in fact is where the external iliac artery terminates. Again, you can post your answer on the discussion forum to get some feedback. The venous drainage of the lower limb can be divided into two, and this is based on principle V6 that tells us that body wall and limbs have superficial and deep drainage systems in both the venous and lymphatic systems. So we will have superficial veins and deep veins. The deep veins are shown here in this left lower limb. Deep veins accompany arteries, so these veins are named based on the artery that they're travelling with. Here on the right lower limb of this image, we can see the superficial drainage system. So superficial veins. Superficial veins lie superficial to the deep fascia here, within the subcutaneous layer. They're important in venous return from superficial tissue layers, but they're not as important as deep veins in actually returning blood to the heart. In fact, some are sometimes surgically removed or even harvested for coronary artery bypass surgery. Now we've already met the two major superficial veins, and they both originate from either side of the dorsal venous arch of the foot. So these are the great saphenous vein running up the limb medially, and the small or the short saphenous vein running lateral and then posterior to the leg. These superficial veins eventually drain into deep veins before the blood eventually returns to the heart. Now just a reminder here that because blood flow in veins is in the opposite direction to arteries, i.e. in veins it flows towards the heart, we describe the origin of veins as the distal end of them. So if we were to actually describe the course of the small or the short saphenous vein, and we're describing the course, that involves describing its origin, its relationships or how it gets there, and its termination. We've already said that the origin of the small saphenous vein is the lateral aspect of the dorsal venous arch of the foot. We can then say that it travels within the subcutaneous layer of skin on the posterior aspect of the leg, and here is the point in which it terminates, and it terminates by draining into the popliteal vein in the popliteal fossa. I'd like you to have a go at describing the course of the great saphenous vein, i.e. what is its origin, relationships and termination. And if you'd like some feedback, you can post your ideas on the discussion forum. In terms of lymphatics of the lower limb, so we heard previously that we will have superficial and deep lymphatics just as we do veins. Principle V8 tells us that the superficial lymphatics will follow veins, so they'll follow the superficial veins, whilst deep lymphatics will follow arteries. These images here are only showing us the superficial lymphatics of the lower limb. And we can see that there are a number of superficial lymphatic vessels arranged in alignment with those two superficial veins. So we can see a sort of a set of lymphatic vessels following the short saphenous vein up the posterior leg. And we can see a set of lymphatic vessels travelling alongside the great saphenous vein up the medial side of the limb. Superficial lymphatics are particularly important in picking up potential pathogens that may enter the body through, for example, a cut in the skin. And these will drain into lymph nodes. It's clinically important to be aware of the location of lymph nodes because they can become swollen and inflamed if they are fighting an infection. So on the diagram you can see a cluster of nodes here in the anterior aspect of the hip crease and a cluster of nodes here in the posterior aspect of the knee in the popliteal fossa. We tend to find lymph nodes where superficial lymphatics drain deep. So we have two inguinal groups up in the anterior hip region and we have one popliteal group in the posterior knee region. In the anterior hip region we have a horizontal inguinal group located here. And these tend to drain lymph from the gluteal region, the lower abdomen and the genital region. The vertical inguinal group are located here and they drain tissues along the course of the great saphenous vein. The popliteal group over here drain tissues along the course of the short saphenous vein. Principle P5 tells us that a painful or swollen lymph node may indicate spread of infection or disease from the region drained by the lymphatics which pass through the lymph node. So I'd like you to consider this question. Which nodes are likely to become inflamed with an infected cut on the little toe? Again, you can post your answers to this question as well as the others on the discussion forum for feedback.